This is the weekly update K through 12 for March 30th, 2021. This meeting is being recorded for the purposes of posting and sharing with the general public a COVID-related update for Pima County charter and private schools. As we start here, just a quick welcome reminder, please type your questions into the chat box. I'll be monitoring that as I go through the presentation today. There are questions that we cannot answer. Those include individual medical conditions or concerns about the vaccine. Again, that's just in pertinence or pertaining to individuals. Well, we also cannot answer questions about education funding or legal issues. Quick snapshot of COVID-19 in the US, data coming out of that. All of this was updated on the 29th of March. Nationally, we've seen over 30,085,827 total cases across the US. We've had over 500,000 deaths at this point in the US. All of this information is taken from the citations that are posted just underneath the graphs. So if you want to go and check out those updates in real time, you can check out the presentation and just click the links embedded in the PowerPoint. You'll be able to visit all of those sites. If you are just joining us, please remember to mute your microphones. Just reduces background noise as I present. Thank you. COVID-19 in Arizona, just in our state, we've had 840,492 cases confirmed and probable, 16,918 deaths in the state. More information here, graphically represented in terms of the Arizona deaths that we've seen, taken from the Arizona State ADHS dashboard, which is accessible by clicking this link here. A reminder that these COVID-19 school benchmarks for our state have changed recently within the last couple of weeks. These are the current standpoint from the state on how those benchmarks actually get represented. What the state looks at is the case rate, the percent positivity to ultimately calculate what the transmission level is with each sub-county. You can see Pima County here, and I need to go back and make sure this is updated, so we'll do that live here in a little bit at the conclusion of this presentation today. COVID-19 cases in Pima County specifically, we've had 112,134 cases. We've had 2,341 deaths. And the COVID-19 cases via a public view ArcGIS document, which I've reviewed with this group before, you can access by clicking this link here. The GIS system is actually really informative and helpful in terms of exploring different demographic data as it pertains to COVID-19 in the Pima County community. You can even look at that by school district or by zip code and get down to that level of analysis to get an understanding of what some of your families may be experiencing in terms of COVID in their communities. COVID testing data. We actually just before this had a conversation with the Delaware Department of Public Health, who is looking at BINAX use for screening testing in their school sites and actually having a really good grasp of what's going on in schools, and using that to really justify the case that school spread, even in high community transmission rates, is significantly lower. One thing that we are thinking would be really helpful for our schools is if you have an athletics program, you can use this BINAX screening tool for a quick rapid assessment on your student athletes right before the game, or right before, especially right before games. That's a key piece, right? Because if you can do a 15-minute screen and show that all of your students on the team are negative, that none are positive, that's going to really put you in a position where you're not going to have to notify another jurisdictional agency, if it's in the case of a track meet, to report that there's been a positive case and then trying to run the contact tracing throughout that situation. This was a rather ingenious idea that I wish we could take credit for, because had we done that, it probably would have prevented a lot of issues that had happened around basketball and other indoor sports. So I want to re-invite everyone to the conversation again of utilization of BINAX and consider some of the other implications. If you have special education or exceptional education populations This is another tool that Delaware was using to do every 2 weeks a screening test of the entire classroom to get a really good understanding of positive and negatives, because the net positive and negative predictive value of the BINAX test is a asset, which again, we didn't capture that language, and we haven't done a very good job of communicating that to all of you. We are planning on doing a additional webinar here in the next week on us just on BINAX use in schools, which I think is going to be really helpful. And it's going to help us communicate better the benefits of using this test. I think it's easy for us to say like, oh yes, it's definitely beneficial, but actually communicating the science behind it can be challenging. So we're going to do a better job of that. And we definitely want to invite you all to the table. If you haven't considered BINAX, or if you are on the fence of considering BINAX, there's a lot of benefits to it.
I'm in, but I can't hear anything.
So just a reminder, if you're just joining us, please remember to mute your microphones. Long-term care assisted living slides, just good information for you to know. And yes, Sherry, I will be sending out an invite for that to the larger groups on both of these. So just keep posted on that, because again, we think it's a really helpful tool that needs to be utilized. And yes, Brenda, you can. Pima County hospitalizations, again, just an overview here. So just a reminder, you know, we're still kind of in the area of where we were between week 37 and week 44. And we are seeing a slight uptick this week from where we were previously. It's just another reminder that this mitigation and the community call to mitigation is a really important thing to do. At the end, there is something about a video that I'm going to make sure I include in this announcement that we're going to do a call to you all to maybe help us out with. But yeah, I'll get to that in a minute. Pima County ICU beds and ventilators. Again, we're seeing a decrease overall of all those things. Vaccinations, we know, do a really good job. Even if you end up getting COVID post-vaccine, the likelihood that you're going to end up in mortality or morbidity qualification, which means either hospitalization or death from COVID, is significantly lowered. So Dr. Fauci mentioned that in a previous speech a couple weeks ago, and I think we'll get that actual quote and post it on this specific slide. But just a reminder again, if you're just joining us, please make sure to mute your microphones to reduce any background noise. I will go through and try to mute where that's coming from. Okay, done. All right, apologies for that. Pima County K through 12 cases and outbreaks. For current date, 3,701 cases just for our schools. The subject matter expert on cases outbreaks in Pima County is Tiffany Jones. Email and phone number located right here on this slide. Stuart Slonaker is a good backup for that if you were unable to get a hold of Tiffany for whatever reason. Excuse me. We've seen an observable downward trend in the last 9 weeks. Had 64 total outbreaks epi-linked at schools, 3 student-to-teacher transmission cases. Again, sports have not been the best friend of us, but again, we think that the use of BINAX could help to mitigate those outbreaks and those spreads if you can continue to utilize those trends. This is a good point for us to just take a quick pause in a moment, though, because we're about to transition into the point where we get into the variants, and we've seen a couple of breakthrough cases. I think it's really easy to look at these numbers, right, and say, oh, 64 outbreaks, we're doing fantastic. We've got thousands of students and thousands of teachers and hundreds of schools across the county. You know, this is a good,
something out about just like be safe over the break.
Sorry, if you're just joining us, if you can please mute your microphone. Thank you. It's a really good reason for us to just go full out and just return. And the only thing that I would just plead with you on that is please, please, please continue to do your mitigation. Communicate to your parents and your communities that mitigation is really important. we need your help with that. We are really struggling right now with community-related level of mitigation. It's getting the community to mask, getting the community to follow those mitigation efforts, the physical distancing. And remember, that's 6 feet for adults. For youth, we've reduced it to 3 because of variable data that we've been able to pull and because of the CDC recommendation. But adult mitigation still recommends 6 feet. So we're on this downward trend. Let's keep that up. And really, we need to make sure that the community is assisting this practice. And there's an opportunity for you as schools to communicate this messaging to the populations that you serve and that you work with. Quick slide on COVID variants. CDC link right here is posted. We know that of the UK variant, we've identified 95 cases in the state of Arizona. Of the P1, which is I think that's the South African. No, that is the South African. There's been 5 of those identified variants in the US at this point in time, none of the Brazilian. So that's been helpful. We don't know how these variants, how widely they've spread, how the disease caused by those variants differs from the disease caused by the currently circulating variants. And we don't know how these variants may affect existing therapies, vaccines, and tests. And that's affect, not effect. Got to remember that. So there could be some things coming out over the next couple of weeks as it relates to vaccinations and these variants that you're going to see us come out and talk about. I got a lot of questions about the variants, so I went into a little bit more detail on some of those on these slides. We'll include this in future presentations and kind of rapidly scroll through it. But for now, we're going to spend a little bit more time on these slides. This is in relation to the genomic testing. So anytime we have a situation, and we do pull about 50 to 60 tests on a daily basis, where we send those up to the state in large batches to do genomic testing, and that's where we're identifying those variants. They're randomized, and the state is doing this statewide. So of that, the total genomic tests that we've run at this point in time across the state are 10,905. The proportion of Arizona cases is 1.3%. That's how we're identifying a lot of those variants. And there's the raw number right there. So you can see the 0.19 here, which translates to 19% in Pima County of those. You can see the percent and the proportion of genomes in COVID-19 cases by month here as it stretches from March 2020 to March 2021. We'll be giving you a little bit more information on another presentation on all of this. But here you go. There's the breakdown of those different values and some of the mutations of interest. This all, again, all be included in the PowerPoint we send out here. I think it'd be helpful for us to pull on someone from epidemiology. So we'll either get Matt Christenberry or Heather McGovern on a future webinar to talk in more detail about some of these points, as well as these different graphs. All of this information is pulled from and updated on 329 from the GIS aid from a task force that was assembled, which is TGen here. So again, we'll get some subject matter experts to talk about this, but this is just to get some of the graphical information in front of you at this point in time, so that you know that coming up over the next couple of weeks, we'll be doing a further breakdown on this. The important point of all of this, the central point or the pith behind us showing this variant information, is that we're not through the woods yet. We have new things coming out, new things emerging. And the last thing we want is to end up back where we were a couple of months ago. So it's really important, which brings us right back to this piece right here, that this layered prevention strategy is a key thing to continue implementing across the board. We can't let up now. We're really in a place where it's going to be a critical point in time and how we practice our mitigation to continue to do so. And it's not far-reaching to think or to observe what's happening in Europe currently, of upwards trends occurring with these various outbreaks. We've got countries that are moving back towards a lockdown situation, and we definitely don't want to be in that space. So we're doing a really good job on vaccinations. We're doing a great job in overall mitigation. Let's keep it up. Keep it up, team. Yeah, high five. So overall, there's some important things on mitigation and prevention, which is what we should be calling it instead of mitigation, COVID prevention, which I want to talk about just briefly. There's subject matter experts on our team, which we'll turn you to. If you want more information on the universal and correct use of masks, give me a call or an email. I can give you out more specific information on what all of that means. If you're looking for physical distancing information, you can check in right here with Kristen King, contact information, phone number, and email right there included. This helpful graph is a good, accurate way to talk about school physical distancing. More breakdown of the CDC recommending the 6 feet here. However, remember that student and school settings are down to 3 feet. We are recognizing the importance social and emotionally of kids getting back in school. And we want to keep kids in school, so let's keep doing it. Other guidance and prevention continued. Hand washing, respiratory etiquette, Kristen King, subject matter expert there. Cleaning and maintaining healthy facilities, Stuart Sloneker, subject matter expert there. With a subset of ventilation, Dixie Siegel is our subject matter expert in that area. And Dixie's actually working with one of the experts over at the University of Arizona right now to put together a brief presentation on a future upcoming call for you all. Where we'll get into more of the details around ventilation, because there's some stuff there with portable air filters and ozone particulate matter and things like that that are important points to consider. So we want to just really come out with really abbreviated, good public health guidance around how to practice that. Contact tracing with isolation and quarantine, Tiffany Jones, super subject matter expert on all of that. Sylvia Vasquez, great backup on that. Phone numbers, contact information right there. Please do continue to report exposures and close contacts with your contact tracing and with your positive cases. This is another area where BINAX is really going to help you out. If you identify a positive case, whether if you have a student that develops COVID symptoms at a school site and you run a quick BINAX, you identify them as a positive, that's an immediate move to quarantine and isolation. That's going to really help you rapidly identify any close contacts associated with that student, especially at middle and high school levels, right? Because we know that the mobility of those students as they move from class to class and in passing periods in hallways, whatever it is it's a high mobility area. And the recall, even over a day's period of time, becomes significantly diminished. So if you have a 15-minute rapid identification of that student as a positive test, you can very quickly identify those close contacts. That is a key mitigation area. If we just go back really quick to the Swiss cheese model, this quarantine isolation piece, and fast and sensitive testing and tracing, right? Those things are really important pieces to look at, okay? Testing for indication and monitoring, Kristen King, again, subject matter expert there, and she can answer all of your questions related to the BINAX and COVID testing. Couple questions in the chat that I'm going to go back and address for just a quick review here. Yes, and I will take full responsibility for not sending out the PowerPoints over the past couple of days. Or the past session, I believe. That's my fault. I'll make sure we get those out to you today. They have not changed the known length of protection of the vaccine at this point, though they are continuing to investigate that. One thing that a metaphor I like to use as a public health approach is, it took us 40 years to figure out that cigarettes cause cancer and that cigarettes were bad for you. So it does take a little bit of research, and it does take a little bit of time for us to really make sure that we have the current updated guidance on various public health related messaging. And vaccines is one of those things where it's going to take us some time to study that, to really identify what the solid outcomes and length of protection are. We do know that it's probably a little bit on the short end. It's a conservative estimate. Based on what we know and the studies that have been conducted. But it is really important to get that herd immunity for folks to get those vaccines in place, because again, long-term benefit reduces hospitalizations and death at a high community level, okay? So that vaccine piece is important. Question from Miss Dolan Dixon. Oh, you open up a worm can with this. Will FEMA be coming into Pima County to open more vaccine opportunities? I'm sure a lot of you saw the news around this. I can't comment on a lot of the specific details. What I can say is that Pima County is currently negotiating with FEMA to open up some pods, which will increase vaccine and opportunities and vaccinations as they open to to Pima County. Stuart there posted the CDC post-vaccine guidelines from the CDC. So please take a moment to check those out. If you haven't, it's there in the chat. For those of you that are joining us by phone, we will include that along with the email and the PowerPoint. So Tiffany, if you can maybe just give me a quick poke after we're done to please remind me to do that, because you're really good at reminding me to do stuff. I appreciate it so much. Tiffany's awesome. Stuart also posted in here who is eligible for the vaccine and when we can get it. That's the Pima County link. We'll pull that webpage up here in a little bit. Visit that along with the ADHS website. Question from Megan Joyce, the CDC update from 3/19/21 removed recommendations of physical barriers. Is that the PCHD recommendation as well? Yeah, we follow the CDC recommendations. Physical barriers are definitely something that we've seen negligible science in relation to whether or not they mitigate or not. In a school setting, 3 feet, masking, and the other layered mitigation are important points that we see. And Dixie there posted a quick link to the CDC ventilation CDC guidance in the chat there as well. All right, thanks for your questions. Keep them coming. Post-vaccine prevention. So already we answered a couple of these questions just a moment ago, but here's some things to keep in mind that you are fully vaccinated 2 weeks after your final dose. If you're getting the J&J, that's 1 dose. Johnson & Johnson. If you're getting the Moderna or the Pfizer, that's 2 doses. 2 weeks, 14 days after that final dose of whatever vaccine you choose, you are fully vaccinated. The things that have changed. Once you're fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people from one other household. For example, visiting relatives who all live together without masks. And this is a key point though, unless any of those people or anyone they live with has an increased risk for severe illness from COVID-19. So again, I want to footnote and keep in mind that in Pima County, we do have a high population of multi-generational housing. And we do have high populations of folks with compromised, man, my words are failing me here. Illnesses that pose high risk of hospitalization and mortality and morbidity of COVID infection. So something like 40+% of the demographics of over 30 or over 40 have increased risk of of illnesses that have complications overlapping with COVID. So obesity, diabetes, things of that nature. Last point on this piece that's changed, if you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms, okay? So if you've been fully vaccinated and you've had an exposure or a close contact, you're exempt from quarantine. You don't need to do anything else unless you develop symptoms. Now, this is an important piece. If you've been fully vaccinated and it's 14 days later and you've got that full vaccinated status, if you've developed COVID-19-like symptoms, we still recommend that you get a test, okay? Because that could be one of the breakthrough cases that we see pop up. What we've seen with the breakthrough cases so far are asymptomatic, and it's just been randomized testing that's identified these cases. All those tests are genomically sent on to, those tests are sent on to get further genomic evaluation, which means we're looking for the variants, and that's going to be a CDC report to contribute to the growing literature around that. But again, the decreased risk of hospitalization and decreased risk of death are really key pieces with vaccinations. Things that haven't changed: continue to mask, social distance, physical distance, hand wash, avoiding crowds, poorly ventilated spaces and public spaces, including schools. All right, so those are things that haven't changed. And that's the update from the 23rd from the CDC right there. And looking at the distribution of COVID-19 vaccine across the county, just give you an overview of what this process looks like. We get the vaccines distributed from the federal government. They go out to the states. And then the county vaccination partners do a couple of different things. Right now, the state directly distributes the University of Arizona State Pod, as well as any other federal long-term care partnership, which is a CVS or your Walgreens, right? That's why we've had some of the differentiation in ages or identification status between the state-run pods and the county vaccination pods. Our county vaccination partners include regional vaccination centers, community health centers, and also mobile vaccinations. We've been doing a lot of work around mobile vaccinations lately. We've been getting a lot of our populations which are at higher risk for that through those mobile vaccine pods. Some of your schools may have participated in those, and those have been super helpful in terms of increasing the numbers of overall vaccines. We talked a little bit about the federal pod and that potentially coming to Pima County, so you'll see some of those roll out here in the next couple of weeks, hopefully. We are still in phase, or actually we're just entering into 1C, which Pima County now is doing 16 and older with high-risk medical conditions or ADA recognized disabilities, as well as 16 and older living in congregate care settings experiencing homelessness. So basically, anyone under this age of 16, those are the only folks that we're not doing vaccinations for at this point in time. Yeah, we are moving and shaking through this. At this point in time, our estimate is that we've done 85% of K through 12 staff, and that's first vaccine. I believe that that's probably a little bit higher, but we don't have a way to gather that data at this point in time. It's just based off of the incentivization for K through 12 staff to actually go and get their vaccine because of the mandates for return to school. We know that with vaccination, side effects are minimal. They indicate healthy response. If you do have some kind of side effect, that it reduces hospitalizations and deaths. I've mentioned that a couple of times. We also have a comprehensive FAQ page on vaccinations. If you haven't got a vaccine, or if you're trying to guide folks to get vaccines, there's a couple of resources right here to look at. You can also go to vaccinefinder.org to look for other state-led pods through Walgreens, CVS, and other pharmacies across the county and state. That concludes the majority of the presentation today. I do have a quick call out. I know that there's 2 schools, maybe potentially 3 on this call that are participating in this, but we're looking for some videos of school staff, students, principals, administrators to do some messaging to the community around the importance of continuing mitigation. It's continuing to mask, continue to wash your hands. Together, we're stronger. We're healthier, Pima County together. I've got a whole script that we wrote up through our communications team. It's a 30-second video, more or less, that just gets across standardized mitigation messaging that really says, hey, as schools, we're finally back. We've gone from Zoom back to the classroom, and we need your help to make sure that keeps going. If you are interested as a school or as a local educational authority on trying to participate in that messaging, then please reach out to me directly. You can do a lot of the footage over cameras, or if you have student groups that want to run that kind of iPhone camera kind of footage, or if you have access to better recording equipment, reach out to me ASAP. We do want to try to get that footage together before Friday, if that's at all possible. So please connect to me at brian.eller@pima.gov if you are interested in participating in that. Last question in here I've seen pop up here from Kay Sullivan. Does PCHD have a position on whether school employees should require that school employees be vaccinated next fall? We do not have a position on that at this point in time. If that's something that you're interested on us taking a stance in, just kind of maybe reach out to me after the webinar, and we can connect a little bit more on that. At this point in time, we don't have a stance on mandated vaccinations for employees. Really, that's a decision that we leave up to the local educational authority or the jurisdictional agency, and that precedence is set by the state, because the state has looked at that jurisdictional agency being granted at the more micro level as opposed to the macro. Again, the kind of video we're looking for is a call to community mitigation to keep kids in the classroom. So I have a whole script I can email out to you. If you've got communications access to good quality filming, or if you think you've got kids or students that can conduct those videos over iPhones and put together something really fun. We're putting together a countywide video. We got some footage from QSD, got a couple other school districts that we have some footage from. I know the superintendent's office is going to help us get some footage from a couple of other schools as well. A big shout out to Matt Stamp for helping out with that. I know I've just got to give a special call out to Matt for that, because I thought I had emailed him and called him on something and I didn't. I spoke to someone else from their office. So Matt, again, I apologize for putting you in that position yesterday, but thanks for being a team player on that. I hope that that concludes us at 9:30 here today. I am going to stop recording and I will take some additional time for questions. So